it is truly just amazing how quickly you see results. And that's what's really exciting about it. And I had laser in my practice before, but it was a much lower power, a class 2. And so we would get fantastic dermatologic results. I mean, if we had scars, if we had things like that.
Right.
And in the first, few millimeters of the skin, it worked great, but it didn't do what this one does, which is really a deep tissue therapy. And because this penetrates up to 3.5, 4 inches.
Wow.
Yeah, and so it's just so exciting. I mean, we've seen some of the research that's been done primarily has, of course, it started with mostly they have done a lot more with animals and things like that.
Right.
Which, when you see the animal actually improve, it's not because you convinced it. It really is doing better. So there's a lot of horse.
Come on, Spot.
Yeah. Well, and definitely in like the horse racing and large animals, they've done a lot. Small animals, I know there's a few clinics here in town that have been using it, and it was funny because a woman was telling me that she came in for it because her cat did so well. And so I was like, and I had no idea. But yes.
That sounds like a great endorsement for a commercial.
Yeah. Well, she thought it must work because, the cat got around better and all that kind of thing. Now, it was for osteoarthritis in the animal, and it does take an awful lot of treatment for that. I mean, that's really a longer-term treatment and not really what we use it for primarily when we're using it for sports recovery and any kind of tendonitis, carpal tunnel, knee problems. Knee and ankle have just been tremendous. All your plantar fasciitis, Morton's seroma, anything that would have just, I mean, it's still not, nothing is overnight. I mean, nothing is going to be an instant cure, but this has just been so fantastic when we talk about that constant knee pain, especially on the inside of the knee where you're running up and down the basketball court, and it doesn't bother you except for going up and down stairs, or it doesn't bother you except for this. This kind of gets us over the hump and really into a new level of healing.
Now, you mentioned in the article something about a particular individual that I think they had, let's see what it is, they had knee surgery, and after one treatment, this particular individual had full range of motion.
Sure.
And had pain reduction.
Now, this was 30 days after the surgery.
Right, exactly.
And they'd been doing physical therapy, so it's not like this was the only thing. But at the 30-day mark, had still not reached full range of motion.
Right.
And really, in 10 to 15 minutes, we had it at full range of motion, and for that period of time, no pain. Now, the pain does return because what it's doing is it's stimulating the mitochondria to produce more ATP, and it's releasing the little painkillers inside the cell.
Okay.
So you feel better pretty much immediately. Quickly. I mean, there is some improvement right away. Some people have, again, no pain as they walk out. Now, the next day, it's not overnight. It's not a one-time thing. But it returns, but not as much usually, and it gets better cumulatively. Each time you get treated, you have a little bit better relief.
It's similar to a chiropractic.
Absolutely.
A group of chiropractic treatments is
right.
you're going to improve.
Yes.
The more you have them, and your body's going to adjust accordingly.
That's exactly right.
Yeah, so it's used for healing. It's a good alternative in some cases, I would guess, to drugs and surgery.
It speeds healing. So what's happening is, I mean, in most cases, and this has been looked at really primarily from a sports medicine standpoint of how fast are we getting people back on the field.
Right.
It's reducing healing times 40 to 50%.
Wow.
And now this is in conjunction with whatever we would also be doing.
Of course.
But so it's amazing how much faster you're seeing people get better. And it's being used with sports teams where as soon as they come off the field, it's reducing that bruise, because that's an inflammation.
Right.
It's reducing all the swelling. It's reducing everything else. So it's just speeding healing. And it's actually speeding the cell itself to heal as fast as it possibly can.
Wow.
And so that's why we want to see you multiple times, because it's speeding it up, and then is going to slow down again, and then we're going to speed it up.
Sure.
So we're kind of pushing it to focus on as much as it possibly can do in that short amount of time.
And once it's healed, it's healed. So you don't have to
right.
you don't have to worry about it after that.
Yeah.
Of course.
Just as anything. I mean, if you re-injure or if
of course.
but yes, it is truly healing. It is not a. It's not just a covering it up. It's not a painkiller where you're just hiding the actual thing.
Right. So it can be used for muscle strains and soft tissue injuries, tendonitis, arthritis. You'd mentioned some of the other things, repetitive stress issues and things like that.
Right. Again, we want to, on any repetitive stress, obviously, we have to reduce or change how you're doing that so that it doesn't continue to return.
For sure.
So it's not, we can heal you for one thing, but if you're going to do it again, I mean, I don't want a false impression that it's truly magic. It does sometimes seem like it in the office when it is so much pain so quickly. It is very, very cool.
Now, I've heard that there really aren't any side effects to this as well.
Well, it's not like ultrasound is a fantastic treatment, and when pitchers would warm up in the pros, before they would ultrasound their shoulder ahead of time to loosen it up. Ultrasound is a vibration, it's a sound vibration that penetrates into the muscle. And while it's very safe, if you used incorrectly, it can, burn the bone and things like that. So you have to be very, very careful. This reflects off bone, so it does not have that same potential. And I know several teams that are now, with their pitchers, that's how they are preventing injury. They're warming the muscle and the ligaments so much so that it reduces the tearing potential. I mean, there's no way to prevent every single injury.
Right, of course.
But by warming up the muscle in the joint, that is how we prevent it as much as possible. That's the same thing stretching does, but not to the same extent. And they're going to stretch with this. They're going to be doing it while they're stretching.
Of course. This is just one more thing that you're going to add to the protocol and the treatment. So that means you mix regular chiropractic treatments and this new therapy to help the patients that you see.
Of course. I have a few people that, for whatever reason, have done that only, and they've gotten good results too. And especially like old scars, old things like that, it's really reducing that. I mean, it's
really?
Just, oh yeah.
Oh wow.
Something you've had for a really long time, it's still stimulating. Your body is continually remodeling that. Even if it doesn't appear like it 10 years later, it's still healing. Well, this is pushing that healing just a little bit faster, especially if you've got a scar that's still red after a number of years. Then this really clears that out. I mean, and the ones that are raised, this flattens them a whole lot. I mean, it's just amazing.
Now, when they start treating someone that comes off the field with an injury, usually the issue is you get inflammation. Does this help with that?
It reduces inflammation. That's one of the number one things it does.
Huge,
in the first, we'll usually do it in maybe we'll do 3 minutes, and then we'll have you move the joint again, and then we'll find out more specifically where it is. So you're really talking about, we can reduce inflammation almost up to 25% just in that first pass, that first 3 minutes. And then we want to identify even closer, where is that? And then we're going to do the therapy with motion. So it's really exposing all the different areas inside the joint or the muscle to the laser therapy.
Now, you mentioned the first 3 minutes. How long is a typical
15 minutes total is depending per area. So, like if you've got a knee and a shoulder problem, we're going to do 15 minutes on each one.
Okay, and it's something where I read you actually have to do it directly to the skin. Is that correct? Or can you wear something? Can you wear?
No, we do it on the skin.
Okay.
We're not doing it through clothes. I mean, sometimes it's depending on what the injury is.
Right.
We have different heads because some we actually do it with a massage as well.
Okay.
And then some, if it's a wound, so that we don't want to touch the stitches, the things like that. We have a different head that goes over it, so it's not touching. There's nothing touching the skin so that it doesn't increase any pain.
Right.
But no, not through clothes.
So what do people usually feel when
when they
come in?
Yeah, it's a warm, pleasant sensation. I mean, just as if you applied a mild
heating pad
heat.
of some kind,
or
something.
Yeah, very similar to that.
Right, and then of course the flexibility that comes back.
Range of motion improves.
That has to feel great. Yeah. that in itself has to feel great.
Well, because a lot of times when you have reduced range of motion, you'll feel this pressure, especially the more you try and bend a joint. It just increases that pressure, so that inflammation has gone down, range of motion is improved, and pain is reduced. So, I mean, it's really just a benefit all the way around.
So who's the best candidate for those people that are out there that are watching this or listening to us? Who's the best candidate to come in and use this new therapy?
Well, and I certainly don't want to say it treats everything, but really any joint restriction, any pain issue, old tears, old muscle tears, like you sprain the ankle so badly a long time and it keeps coming back and keeps coming back, is really going to be a great candidate. Plantar fasciitis is a great candidate. Any of your tendonitis problems. So that includes, golfer's elbow, tennis elbow,
right.
A lot of shoulder bursitis issues, your carpal tunnel, definitely. All of these are almost, we do a lot with the low back and the neck. We treat, even migraine headaches and that kind of stuff. That takes a lot longer. But boy, the extremities, the joints have really benefited so much.
And is there, obviously there is a difference in the number of times that you need this treatment to heal. It's going to be an individual by individual thing, but what's the usual number for?
On average, we have, everyone has the great story where 1 to 2 times it was just fantastic, but most of the time, assume like a 10 to 15 times.
I gotcha. And even for super athlete type of people,
it makes no difference.
If you get,
it still works, just the same.
And if you suffer an injury, the statistic that I read is if you get a treatment within 2 to 3 hours after an injury, the rehab time can be cut in half.
Right, because
that's not just for an athlete, but that's for just a regular Joe out there too.
Well, because that's how long it takes to full reach. You're continuing to have swelling. Let's say you sprained your ankle. You know how long? Yeah. The worse it is. If you have a terrible sprain, it swells like that. Yeah. But for the most part, it's swelling up over the next couple hours.
Right.
So if we can reduce that, the swelling itself is meant to splint. The body's idea is like, let's splint the area so you don't move it at all.
Of course, yeah.
But by doing that, it also distends all of the tissue around the area that's swelling. Right. And so then that area has to really reestablish its position. And so that may take weeks or months. And so if we don't distend it so far, if we treat it quickly, and that's why they treat athletes as they come off the field,
right.
The less inflammation you get in the beginning. There's some reasons why we want that inflammatory response, but for the most part, especially like you said, you're not the professional athlete and that kind of stuff, we just want to treat it quickly.
Sure. So
it's any chronic problem. The longer you've had the problem, the longer it's going to take to fix it.